If you or someone you love had a stroke and now struggles to find words, that can feel incredibly frustrating. The thought is there, you can see it, but the word just won't come out. This is often called aphasia, and speech therapy for stroke patients with aphasia isn't about strengthening the mouth. It's about retraining the brain's language system. The challenge is this: if you practice the wrong way, progress slows. But when you practice the right way, the brain can start rebuilding those language pathways. So today, I'm going to walk you through some simple, practical strategies that you can use at home to improve your aphasia after stroke. But before we get into these specific strategies, it's important to understand how aphasia works, because aphasia is not a muscle problem, it's a language network problem in the brain. That means improvement doesn't come from strengthening the lips or tongue, it comes from activating or rebuilding language pathways. And our brains rebuild through repetition, consistent, intentional reps. Not random conversation, not occasional practice, but repeated language activation. The more the brain is asked to retrieve words, form phrases, process meaning, the more it can stimulate and rewire. And that's how speech therapy for stroke patients with aphasia actually works. So let's get into how you can do this at home. The first strategy we're going to go through is focused word retrieval. This means intentionally asking the brain to pull up words on demand. Here's a simple way to do it. First, pick a category. It could be animals, tools, fruits, kitchen items, whatever. Then set a timer for 1 minute and have the person name as many items as they can in that category as possible. If they get stuck, you can give a gentle cue like the first letter or a description instead of saying the whole word. But the goal here isn't speed, it's activation. You're asking the brain to search for and retrieve language repeatedly. So start by keeping sessions short, 1 to 3 minutes per category. You can do 2 or 3 rounds and just stop before fatigue sets in. And just know that short, focused, and repeated practice works better than long, exhausting sessions. Now let's move on to the second strategy called script training. This focuses on practicing short, meaningful phrases that actually matter in real life. Instead of just random words, you practice sentences the person actually needs. For example, I need water, or I'm tired, or I want to go to bed. Just pick 3 to 5 phrases that are personally important. So here's how to practice them. First, we're going to say the phrase slowly together. We're going to repeat it several times and then pause. And then have the survivor try it independently. If they get stuck, give a small cue, not the full sentence. And remember, consistency matters here more than volume. You're building predictable language pathways through repetition. And because these phrases are functional, progress starts to feel meaningful. When someone can reliably say something that meets a need, frustration drops and confidence goes up. So keep the phrases short and keep them relevant. And be sure to practice daily because small, consistent wins add up. Now let's build on that. The third strategy is structured reading aloud. This works because it gives the brain support. The words are visible and they don't have to come up with words on their own. But just start with short sentences. Large, clear print helps too, but have the person read slowly. Accuracy first, not speed. If they get stuck, give a small cue, like the first sound of the word instead of reading the whole word for them. Reading aloud activates multiple systems at once, seeing the word, recognizing it, and saying it. That layered activation strengthens language connections. But keep sessions short, about 5 minutes is often enough, and just stop before frustration builds. The goal is steady activation, not pushing until they're exhausted. But if full sentences feel too hard at first, that's okay. Just start with some single words and build gradually. And now let's look at a strategy that sometimes unlocks language in a completely different way. This fourth strategy uses something surprising: melody. Sometimes people with aphasia can sing words more easily than they can speak them. And that's because music and rhythm activate slightly different areas of the brain. So here's how to use that. First, we're going to start with a familiar song. Something simple, like Happy Birthday or a favorite hymn, or a short children's song. And we're going to sing it together. Don't worry about performance. Just focus on rhythm and flow. Then we're going to try taking a simple phrase like I need help and say it with the rhythm, almost like you're lightly singing it. This can sometimes help the brain access language in a different way. And just like the other strategies, keep it short. 2 to 3 minutes is often enough because we're looking for activation here, not perfection. Now, let's talk about frequency. Short sessions work best, but short doesn't mean once a day. Think in small blocks, 3 to 5 minutes several times throughout the day. Just know that 2 to 5 short sessions is often more effective than 1 longer session, because language recovery responds to repetition and frequency of activation and stopping before fatigue sets in. So consistency matters more than duration. And there's one more piece that's just as important as the exercises, but it has nothing to do with drills. It's about giving time. When someone with aphasia struggles to find a word, the instinct is to jump in and help them finish the sentence. But here's the problem. If we consistently supply the word too quickly, the brain doesn't get the chance to search. And that search process is what stimulates the rewiring. So instead, try this. Ask a question, then wait. 5 seconds, even 10 seconds if needed. It might feel a bit uncomfortable, but that's okay. Struggle is not failure. Struggle is activation. Now, if frustration builds too much, then you can offer a small cue, but give the brain some space to work it out first, because that pause can be powerful. But it's only one part of stroke recovery. Language, movement, attention, endurance, they're all connected. And progress happens faster when recovery is structured. So if you want a simple and clear way to understand what stage of stroke recovery you're in and what to focus on next, then I put together a 5-minute recovery roadmap that walks you through exactly that. You'll learn what stage you're in and you'll get the next right step for your recovery. So check out the video's description to get a free link. And if this was helpful, then be sure to subscribe because I break down stroke recovery step by step.